Morning, everybody. Thank you so very much for joining us on this Monday morning to hear all about the Now program with Kara Brandell. We are so excited to have you guys here. And again, thank you for joining us. So without further ado, I would love to pass it off to Kara to tell us more about the Now program and progress and everything like that. Kara, thank you so much for being here.
Yeah, thanks, Abby. I am in St. Louis Park right now, and a storm is just starting. So hopefully we get through this without, I don't know, the electricity going off or something. But
Yes.
thank you, thank you everyone for coming. My name is Kara Brandell. I am a clinical psychologist. So I graduated with my doctorate in psychology in 2009, and have worked for at Park Nicollet as a psychologist, as a licensed psychologist since 2010. And then in 2015, I took the role of clinical manager for our child and family mental health team. And so now I split my time between my management role supporting the therapists and psychologists here and providing therapy and psychological evaluations to kids and families. And it's through my management role that I get to be involved with the Now program, supporting the therapists in the program. So I want to tell some stories about students who have benefited from the Now program as I provide more information about what we do and why we do it. This is partly because the picture can seem fairly bleak. And many of the kids we have seen through the Now program have happy endings. So these stories are what keep us going as therapists, and I'm hoping that they'll keep you going as well. Through this presentation to help you remember that although the state of mental health for our kids and teens can seem sad, there is hope. So my first story is about a student who was seen in the Now program, who immigrated to the US within the last 2 years and came to this country with a significant complex trauma history. At the initial appointment, the student described to the therapist struggling significantly with depression and having frequent suicidal ideation. The student also described previously attempting to take their life multiple times. They also described symptoms of post-traumatic stress disorder, such as feeling like life wasn't real, avoiding situations that reminded them of their trauma, and then also experiencing the emotions and sensations associated with their trauma throughout their day. This student really recognized that they would benefit from therapy, but couldn't access it for a couple different reasons. So their parents didn't speak English, and they didn't have the financial resources or transportation for them to be able to access therapy. During therapy sessions, the therapist described the student as really soaking up all of the information and skills that they were offered. They were ready for therapy. They started using skills to improve their sleep and start managing their symptoms of depression right away. And after only 2 months of therapy with a Now therapist, they endorsed significant improvement in mood and fewer suicidal thoughts, and no more suicide attempts. They were attending school regularly and had improved their relationships with family members and had made some really strong peer relationships as well. So this summer, they plan to process some of their past trauma. So have gotten through kind of the or have begun to manage some of the emotional dysregulation and depression enough so that they can process their trauma to continue to build on their resilience as this team navigates their upcoming developmental transitions like graduation. So this is the bleak part, to talk about just pediatric mental health in the US. So many of us know that mental health has always been incredibly important, especially in our developing youth. In the mental health professional world, when the mental health crisis was officially recognized in 2021, we were torn between cheering for the recognition of the crisis and putting our heads in our hands because we knew this crisis existed long before the COVID-19 pandemic. It the pandemic absolutely made things worse, I think. And I'll talk a little bit about that. But this mental health crisis for our kids and teens and the lack of access to mental health therapy and resources has been going on for a long time. There's a lot of data focusing on mental health of kids and teens from pre-pandemic times. So in listening to the Surgeon General on this subject, he often cites 3 facts, which I think are pretty moving. Between the time a child or teen experiences symptoms of mental health concerns and them receiving the help they need is 11 years. So it's 11 years between the time a child or teen starts experiencing mental health concerns and the time that they actually access the help that they need, if they're able to access the help that they need. So 11 years is a huge amount of time when we're looking at a lifespan that's been 18 years total, right? So the ability to access mental health care is really difficult. Also, so the second fact is there was a 57% increase in suicide rate during the decade before the pandemic. So even prior to the pandemic, we were seeing suicide rates for teens increasing significantly. And the last fact that the Surgeon General often shares is that prior to the pandemic, 36% of high school students reported feeling persistently sad or hopeless. So, and in 2022, it was closer to 44%. So we're, between a third and almost a half of high school students are feeling persistently sad or hopeless. The biggest question we often get is why? Why are mental health concerns like depression, anxiety, eating disorders, substance use disorders, why are they increasing in our youth? Which is a very complex question with a complicated set of answers, and this will depend on who you talk to. So I'll share my thoughts. The pandemic definitely put strain and stress on individuals and families like many had never experienced before. And the impacts of this are likely vast and not well understood yet, especially the long-term impacts. During the pandemic, kids and teens experienced the strain and stress themselves and watched their parents experience it too. And that was isolating for many of them, as they didn't feel like they could talk to their parents about the stress that they were experiencing because of the amount of stress that the rest of their family system was also experiencing. From my team of mental health clinicians and my outpatient team, I heard that they were experiencing higher rates of burnout. And so that was something that we were dealing with too. During the height of the pandemic, what they were trying to help their patients with and the families of their patients with were the same difficulties, the same stresses and strains they were experiencing themselves. Or they were trying to help their kids navigate the difficult situations that the pandemic put us in. And so the type of kind of professional separation that we use to be able to help others with their mental health and not burn out ourselves was unavailable in many ways. And so the clinicians themselves were struggling with burnout, and our team shrunk during that time because a number of clinicians decided that they weren't, at that point, they weren't able to continue. I think, and I'll talk a little bit more about just the size of the pool of mental health clinicians or therapists. I think this was true before the pandemic as well, but loneliness has played a big part in increasing mental health struggles. I think the pandemic resulted, in social isolation, and I think social media can cultivate loneliness as well. As the use of social media has increased, the engagement of our teens and kids and involvement in community institutions and like face-to-face connectedness has decreased. Research has shown an increase in feelings of loneliness, especially in those who use social media passively. So looking at their feed and seeing what others are doing and comparing themselves unfavorably. I think about being a teen myself and occasionally finding out that a group of friends got together and I wasn't invited, and how hurtful that was, right? Feeling left out. And then I think about the teens now with social media and how everything is put online, right? Pictures of everything. And so I imagine finding out every time a group of my friends hung out without me or didn't invite me, and how hard that would be. And so I think there's just a lot that our especially our adolescents, kids too, are dealing with right now, just from a social standpoint, and how that impacts their mental health. Um, the Surgeon General has also talked about youth's experience that he's learned about, of feeling pressure to be on social media because everyone else is or seems to be, um, and also knowing that it makes them feel worse, right? So that understanding that it is impacting mood, um, but not feeling like you can stop looking either. We really don't have good data about who's harmed and who benefits from social media usage, and the type of usage, what type of usage harms or benefits teens the most. We don't have good data on where the healthy boundaries are when it comes to social media. Um, the introduction to social media has been called just a giant experiment we're conducting on our kids and teens without data that would indicate what the impact might be, which is scary. I think current events and divisiveness in our politics and in our communities have an impact on our kids and teens as well. When teens are in middle school and high school, and are asked to engage in the super important process of considering their future and deciding what they want to do and who they want to be, they're faced with the realities of climate change, racism, violence, and war, among other things, and understandably struggle to feel hopeful and motivated. So, and I'll talk some about how the Now program addresses these, but I want to talk a little bit just about the barriers to accessing mental health care. Um, so one is there's just a limited number of mental health clinicians. So limited overall, and then the number of mental health therapists who treat kids and adolescents is way lower, right, than overall. So it's a small pool inside a slightly larger pool that's still too small to serve the needs of our community. So I've heard about 4% of all mental health therapists treat kids and adolescents. Um, Time is another barrier. So, the time that it takes to engage in therapy or any mental health care um, is a huge thing. So missing, students or kids and teens have to miss school. Parents have to miss work to do kind of traditional outpatient care. Um, Often in these families too, right, there are siblings. And so there's this coordination need of schedules that can be really, really hard on families. And obviously, for mental health reasons too, we don't want kids missing school, and we really don't want parents missing work either. And even if you can get appointments outside of school hours, often that means missing activities, teens and kids missing activities that increase their sense of belongingness. And so that's not always ideal either. Um, Transportation is a barrier too. So access to your own personal vehicle or transportation, dealing with car difficulties, dealing with traffic. Again, those like really the popular appointments are before and after school and are also during rush hour and traffic. Using public transportation can be really unpredictable as well. Um, Stigma is another one. And so I like to talk about stigma using kind of a medical correlate. So if you had appendicitis, you would absolutely seek medical attention, right? No one would expect you to be tough and deal with it on your own. You wouldn't be ashamed of seeking help. Um, but when people are experiencing mental health struggles, they often do feel ashamed. And it's hard for them to seek help. They feel like they should be able to just suck it up and just feel better, right? Just make yourself better. And we all know, I think, that that's not true, that that's often not possible. But going to a mental health clinic can contribute to these feelings of shame and embarrassment. So it can stop people from seeking the help that they need. Um, Money is another one. So for kids and teens, we often recommend weekly or every other week appointments. That's kind of the frequency that's most effective. And because of the frequency, co-pays and deductible payments add up, and so can really stop again, patients and families from seeking the help that they need. There are families, that lack insurance coverage or consistent insurance coverage, so it can be variable. And even if they do have coverage, they could lack comprehensive mental health benefits. The last barrier I want to talk about is just language and culture. So if you think about the limited pool of mental health clinicians that I talked about, right, overall, and then there's fewer mental health clinicians that treat kids and families, there's even fewer mental health clinicians that are able to do therapy in languages other than English, or understand, the diverse cultures or are from diverse cultures. So the pool of mental health clinicians just kind of keeps getting smaller as we get more specific. We are lucky at Park Nicollet Health Partners that we have access to a huge team of translators, interpreters that cover a whole bunch of different languages. So that's a resource we have. It's also a resource that the Now therapists have. But still doing therapy through a translator or interpreter is difficult, especially for patients who are trying to process usually really difficult emotions. And sometimes mental health concepts don't translate well, or easily anyways. In addition, there are a lot of cultures too that don't recognize mental health issues, or the stigma around mental health issues is so enormous and sometimes insurmountable that seeking help is extremely hard for people from those cultures and can actually have pretty negative impacts on them in their communities. So now for a little bit brighter part, to talk about kind of what the Now program has done to address some of these challenges. So in 2014, leaders from the Park Nicollet Foundation recognized that access to mental health care was a problem. Probably not the first time they recognized that, but attention was drawn in 2014, and they developed this program, which, as the name implies, removes obstacles to accessing high-quality mental health care. Now stands for No Obstacles to Well-Being. And so the whole goal was to remove those barriers that I just talked about. So the creators wanted to offer this program within the schools so that patients missed less school time, right? And they wanted to offer it via telehealth so that the clinicians also didn't have to travel to schools or between schools. Again, with attention to mental health care is hard to access anyways. So any time that a mental health therapist has is pretty valuable. So they didn't want time to be spent in the car. Developers knew that this would have to be offered free of charge, right? To remove the obstacle of money and insurance coverage, things like that. And so would have to be supported through philanthropy. They also knew that they wanted to target schools and districts that had high mental health needs. So the program began with St. Louis Park Middle School and then expanded to Richfield High School and then Burnsville High School. When Richfield High School was identified as a school that would benefit from the Now program, and they learned that a high proportion of students there spoke Spanish as their primary language, we hired a therapist who speaks Spanish so that therapy could be conducted in either Spanish or English, depending on what the patient preferred. This therapist also now, as of this past school year, provides therapy in Spanish at Richfield and for Spanish-speaking students in Burnsville too, just to make sure that we're covering as many students as we can in the language that they would prefer to do therapy in. This model also allowed for improved collaboration between the school and therapist, kind of compared to traditional outpatient therapy. So our therapists have done a lot to advocate for students to receive like accommodations at school to help manage their anxiety or PTSD symptoms. They've written letters to immigration lawyers. They provided psychoeducation about mental health to immigrant parents who are skeptical. So just the collaboration between the therapist and the school and the community and the parents has been pretty huge in this program. In 2014, the use of telehealth or therapy over video rather than in person was really groundbreaking. So the rest of our programming was developed to be offered only in clinic in person. These days, it's become much more common, which is a win for our communities. Much more common to provide telehealth therapy over telehealth, which is a win, right, for our communities in terms of removing transportation and some time as a barrier to many who would benefit from mental health care. From 2014 to 2020, now, so 2020 being the start of the pandemic, right? So now use these big systems that were connected virtually. So one giant monitor was in the clinic and was connected to another giant monitor that was in the school. And these were really expensive pieces of equipment. They were uniquely used to provide a secure connection to maintain privacy. And then in 2020, when the pandemic hit, it forced us as the kind of, I don't know, the organization, the world, our department for sure, to find easier ways to connect securely with our patients. And we transitioned now, along with the rest of our department, to a really kind of state-of-the-art telehealth platform that allows us to have a private and secure connection with the students. And the students and the therapists also were able to use laptops and cell phones instead of these huge monitors, right? So this allowed them access to a more mobile form of telehealth and has allowed our therapists to provide treatment to students while they're not at school. So like during distance learning, they were able to stay connected during school breaks. So summer break, spring breaks, things like that. In the past, students would have to travel to the school during summer break to receive therapy using that giant equipment. And now they can receive therapy while they're at home using their own cell phones or iPads or laptops. So it's really helped with consistency in therapy for these students. At the start of the program, the intention was for the Now therapist to be referred from the school, kids and adolescents who are struggling, but not to the extent that they needed traditional clinic-based therapy, so traditional outpatient therapy. What we found is there are too many kids and adolescents who require the same level of care we offer in our clinic and sometimes more. So some of these students are struggling, some of these students that they're seeing in the Now program are struggling with highly acute and serious mental health concerns, food insecurity, homelessness, and trauma, and wouldn't otherwise have been able to access skilled mental health services. So rather than the short-term intervention model that we had intended in the beginning, we're providing crucial and sometimes life-saving care to kids and adolescents who need it so desperately. So I have another story for you. This is about an 8th grader, so about 14 years old, that was removed from her home this year due to being abused and neglected. So as is often true, this is a really complex situation. This was an immigrant family with very limited financial resources. The patient was living with her mom and another adult caregiver who was helping out. And her mom had significant mental health issues. The other caregiver that was helping out with the patient and her sibling committed suicide. And so this child was understandably struggling. She was experiencing depression and anxiety and difficulties with attachment and developing relationships. She was extremely behind with her education and slept through almost every school day. So this was her way of coping with the stress that she was experiencing. And obviously with safety and security struggles, right? It made it really difficult for her to care about school and her education. Without the Now program, this child wouldn't have been able to access mental health help. However, because of a combination of social services and therapy and a strong school support, by the end of the year, she was engaging in and benefiting from therapy. She had an IEP or an education plan to help her get back on track academically. She was really participating in school and living in a safe environment. So the school's given feedback that they can't believe the change and improvement in this child. So current state of the Now program, this is a small but mighty program. So we cover 3 schools. So again, St. Louis Park Middle School, Burnsville High School, Richfield High School, and have 3 therapists that cover those 3 schools. In 2023, we provided 586 hours of therapy across those 3 schools, and 100% of students who received therapy through the NOW program reported that they learned new skills to manage negative feelings. The care that's provided through the NOW program is really high quality. So to tell you a little bit about the therapist, so Diane is our therapist who serves the St. Louis Park Middle School, and she's been a practicing therapist with Park Nicollet for 28 years, and she's been with the NOW program since its inception, so 9 years ago. Amy is the psychologist that serves the Richfield High School, and she's been a practicing psychologist with Park Nicollet for 6.5 years, and has been with the NOW program for about 6 years. She's our Spanish-speaking therapist, hired pretty specifically for the NOW program. Abby is our therapist who provides care to the Burnsville High School students. She's been a practicing therapist with Park Nicollet for almost 2.5 years, and started with the NOW program about 1.5 years ago. So all of these therapists are highly skilled in recognizing and treating trauma and the range of mental health difficulties that present both in the schools and in our larger behavioral health clinic. They also carry a caseload within our outpatient clinic. They participate in consultation with each other, so get professional guidance from each other, and also from our larger mental health team in our outpatient clinic. And they engage in ongoing continuing education to stay up to date and grow in their clinical practice. The level of care they provide NOW students is of extremely high caliber, and the same care they provide to the patients they see through the clinic. They're dedicated to the program, all 3 of them, and believe in the mission, often going above and beyond to work to ensure these high needs students get the support they need through therapy as well as from their school and at home. And the care they provide is comprehensive. So if they recognize that one of their students requires a different type of therapy, so occupational therapy or speech therapy, or maybe would benefit from psychiatry or medication, or even like psychological evaluations, they can refer and help that student access these different services or even more intensive services by collaborating with the student and their parents. So it really is comprehensive. And it's cost efficient. So the cost of a therapy hour through the NOW program is cheaper than a therapy hour in the clinic because of the dedication of our department to this program. My final story is about an 11th grade student, so about 17 years old, who is facing really multiple and complex challenges, including a long, painful history of family conflict and our own recovery from a really serious medical problem. She met with a NOW therapist to do some really challenging therapy over the course of about 1.5 years school year. She's made huge strides recovering both physically, medically, and emotionally. So this year, she is the captain of a sports team, and is on track to graduate and has received a full scholarship to a university. So this program works, and we're really, really proud of it, and really, really proud of the work that these therapists do to help students in their schools. So again, I really appreciate all of you coming to listen. And I think we get to do some questions and answers now.
We do, absolutely. Yes, no, Kara, thank you so much for sharing these stories and these facts about the wonderful benefits and life-changing types of care and impact that they can have for adolescents in our area. And so if anybody has any questions, please enter them here into the Q&A box and I will read them off to share with Kara. One question I do have, Kara, is you were mentioning how through one of the schools that there was that great need for Spanish translators and everything like that. How do you identify those specific needs? Because it sounds like the Now program is so adaptable
Mhm.
to the needs of adolescents at each of these three schools. But if you could speak a little bit more to that about how you're able to identify that,
Sure.
that would be great.
Sure, yeah. So all the students are referred from either school staff, like teachers, or administrators, and or school counselors, right? So school counselors in our schools, I think kind of throughout Minnesota, are really overwhelmed, right? So they might do what they can do, but if the student has more complex needs or higher needs, then they'll refer to us too. So within the context of that referral, we find out what the language what the primary language is that the student speaks, and how they prefer to communicate. And then we have our Spanish speaking therapist who will see students at Richfield High School, or from Burnsville High School, because we also found that there was a high need for Spanish speaking therapists in Burnsville High School. Or we can use our interpreter services who can join video visits through our online platform. And so um, we can always get audio. We sometimes get video too for the interpreter. And so then we work through them.
Thank you so much. I was just curious about that because it's just one thing that I'm sensing from learning more about the program is how adaptable it is and how
Mhm.
it meets patients where they're at, which is so wonderful and so important. And I know it looks like we do have a question here. Yes, are there, well, a few questions actually. Are there students who are enrolled in Growing Through Grief who are also enrolled in Now?
Um, I would imagine. So growing through grief um, addresses kind of acute situations, right? Losses within the school or family, individual family losses and things like that. So I can imagine that that's possible. I guess I'm not totally sure that it's ever happened. But growing through grief is offered at all the schools that we provide now therapy to. Um, so it's definitely possible.
Thank you. And then another question we have here is if you had to think about a wish list for the Now program, what would be one or two things you would ask for to enhance Now and better serve our kids?
Sure. Um, So one thing that has been hard, and I think this is just part of the school districts too, is having consistent support within the school to make sure that all of our now therapy hours are filled, right? So to make sure that we're just using them to the greatest extent. So like St. Louis Park Middle School usually has a coordinator, so someone in middle school too is a little bit different, but having someone to like actually go and get students to come to their therapy appointments if that's needed, and to make sure that the therapist schedule is full, so they're seeing as many students as they possibly can because we want to use them as much as we can. um, Richfield High School is lucky too, because they have the health center, and so the one of the employees of the health center of our health center in the school does the coordination for the high school students. So they don't need as much like someone going to get them, but they make sure that that therapist schedule is always full. And then Burnsville High School has been just less consistent, right? So they have their own kind of internal school struggles. So that would be one wish list, is just like, or one thing I would wish for is just consistent kind of support within the schools, to coordinate the schedules and care and things like that. Um, the other thing that would be awesome is if we could expand. So I think that this is a fantastic program. And I think if we could serve more schools, I think that that would be amazing. Um, and is difficult just because of the limited number of mental health professionals, um, and just the complexities of mental health department as well. But that would be the other thing, is just expansion.
And I guess a follow-up question I have to that with your expansion is it like you were saying, with the limited amount of mental health therapists that could be there to help provide services at additional schools? Is that the barrier to expansion, or are there other things that philanthropy could potentially help with to alleviate those barriers?
Yeah. So I think that I mean, that is one barrier. So just, so I have been part of this manager role, for what, 9 years, I guess now, and I have never stopped recruiting. So it takes a really long time to find and hire child and adolescent therapists. So compared to like our adult team who hires, they can hire adult therapists, it seems like really fast. I will sometimes go 6 months without application. So yes. So like the number of therapists is hard, and try to keep our clinic staffed, in addition to hiring now therapists, is difficult. Um, the other thing, I don't know, this is probably not a surprise to anybody, is money, right? So there is a cost always to the department, um, for the now program, which I absolutely, the department is dedicated to this program, but I think that it's hard, just because of money things too. Yeah.
No, thank you for that. And then just a quick clarification question. So when you were sharing the impact information with the NOW program in 2023, was
Mhm.
that 57 students alone that were served in 2023?
Yeah. So 57 unique students. Yep.
Wow.
Yep. And I think, I don't know. So I mean, it's 57 students is awesome. And I would just again say, like, that's 57 students, all of which were really actually complex. You know what I mean? And had complex trauma in a lot of cases, depression and things like that. And so those 57 students, together, right? 586 hours of therapy. So these were not simple, these students were not short term, they didn't need short term therapy. They needed significant help and support. Um, so that's probably what I'm most proud of from our therapists, is just their dedication to those students.
Absolutely. And I think this goes without saying, but just with the amazing work that you all do with the program to set kids up for success and address barriers to helping them grow as they get older is huge. And one question I also have is, and just, and correct me if I'm wrong, but just one, like, could you describe what that looks like with like the follow up with kids after those hours of therapy? Like, do you do
Mhm.
check-ins or anything like that? Like, or what is that? How do I phrase this? What
Mhm.
does it look like, once you feel that a student has received a good, like the amount of therapeutic services that they would need to
Mhm.
heal, for lack of a better way of putting it? How does that loop back process look like with checking back in with them to see how they're doing? I'm sorry, I'm struggling to like figure out how to best.
Yeah, no, that makes sense. No,
Yeah.
that totally makes sense. Yeah, no. So, and I mean, I think it's a difficult question too, just because often we don't know. So, it's usually a collaborative kind of process, right? The therapist might see the student as kind of having reached their goals, or like being in a better spot, right? Than they were when they started. So maybe ready to be done with therapy. The student also has to agree that they're ready to be done with therapy. And sometimes that takes some time to figure out together. So it's usually a collaborative type of process. Um, with the Now program, if a student needs follow-up therapy, you know what I mean? So if they think they're good to go and then something else maybe happens in their life, or those stressors come back, or symptoms come back, they're always able to re-access their therapist, right? As long as they're in that school. They can also access a therapist in the clinic if they want, if they need to, right? So if they do, we don't we don't ask any questions about insurance or ability to pay, right? So like it's just no obstacle, right? Whether you have insurance or not, you can be seen with the Now program. If the patient is able to access outpatient services, they can always see their therapist here too as an outpatient patient. So say they graduate from high school, or they move from middle school to high school, and they decide they want to come back and see their therapist is here. And that's happened a number of times, where because they've already benefited from therapy, we have the buy-in from parents. And sometimes they do have the resources to be able to come to the clinic too, which is awesome. Um, and then so we don't have any kind of official type of follow-up necessarily, but what we do know is that if we can help kids and teens early on, it two main things happen, right? One is they build skills and resilience to help them navigate kind of the bumps in the road as they grow, right? And as they go through these developmental stages. And so healthier kids and teens means healthier adults. So we know that there's a long-term impact of therapy. The other thing we know is that if kids have had a positive experience with therapy, if they need it again in the future, they'll seek it out, right? And so they're better able to recognize when they might need follow-up help, and to feel comfortable doing so.
So thank you so much for sharing that. And also, everybody on the call, if you have any other questions, Kara, would it be okay if I refer them to you if they don't contact you
Absolutely.
directly?
Yep, absolutely.
Awesome. Well, Kara, thank you so much for sharing your wonderful presentation today about the excellent work of the Now program. I'm at a loss for words about how like special the program is, other than the fact that it's very life changing for these adolescents. So thank you for the amazing work that you do and for your time today sharing it with us.
Absolutely. It's my pleasure. Thank you for inviting me, Abby.
Absolutely. Have a great day, everybody. Thank you.
Thank you. Bye, everyone.
Bye.